friends, welcome to CEC Gurukul live lectures. Dear friends, this is a session on career counseling called Pratibha Sambardhan, and today we would be talking on public health and public policy. Now, you might be wondering how public health and public policy is related to the careers. Yes, definitely you can make a career in this particular area, and for that too we have a special guest with us, and she would be explaining us in detail first of all what public health and what public policy is, and how one can find a way by adopting these careers and having a blissful future ahead. So let's welcome our guest, Miss Sejal. Miss Sejal is a career counselor. She is a Delhi University student who persistently makes efforts so that she could motivate students. So let's welcome Miss Sejal once again. Hello, Miss Sejal. Welcome to the session.
Hi.
We have heard a lot about public health, public policy. These terms are, often we are familiarized with. We often hear these words somewhere or the another. But when we talk about careers in these areas, how lucrative these careers could be in the particular area, and the question arises how one could make or how one could find a way to get into this particular area. So over to you.
Yeah, thank you so much, Ms. Gitika, for your warm welcome. So basically, talking about public health and policy making, I'll just introduce myself. I did my bachelor's in human development from Delhi University, after which I pursued my master's from UK, from QMUL University, London, where I did my master's in public health and policy making. So initially, while starting this journey, I was not very familiarized where to do the specialization from, how to start with public health and policy making as a course from a particular university. So eventually, once I started, I realized that people are not well aware of public policy, how things work, how these policies affect public health, and what public health in general is. So first we will talk about what public health is, and then we will switch to how policy making is affecting public health. Then we'll also talk about the agendas that should be initiated at the school level itself so that public health can be taught in the school level itself. Then we'll also talk about the programs, we'll also talk about the initiatives taken by the government, so that unless and until we have the realization what public health and policy making is, we cannot move forward in the specialization, be it undergraduate, graduate degree, or it is a postgraduate degree. So first, we'll talk about what public health, what public policy is, how these terms work all together in a general manner, in the community, in a global level, at a local level itself. And then we'll also talk about the decisions that has been made by the government itself. So first, public health. Public health in this area, public health is just the science and the art of understanding how promoting health works, how promoting lives of healthy people work in the community. We'll also talk about how understanding of public policy works in a general area. So, for example, if I start with a program called the Samagra. Have you heard about Samagra?
No, I haven't heard about about Samagra ever. So what Samagra is?
So basically, it was a program that was being initiated by the government itself. Samagra program is basically, as told by you, कि समग्र के बारे में बहुत लोगों को इन्फॉर्मेशन नहीं होती. ये एक ऐसा प्रोग्राम है जो गवर्नमेंट ने स्टार्ट करा था रूरल इंडिया में. तो रूरल इंडिया का क्या पॉइंट था कि देयर वर नॉट वेरी सैनिटरी हेल्थ प्रैक्टिसेस अवेलेबल, फूड, क्लीन वाटर वाज नॉट बीन अवेलेबल टू द पीपल. सो दिस एक्ट वाज बीन प्रमोटेड बाय द गवर्नमेंट सो दैट ये क्लीन एरिया वगैरह सारा एक अल्टीमेटली अवेलेबल हो. Now when talking about other agendas like GDI, Global Development Index, basically एक और initiative है. What happens is, जब तक हमारी community में we do not understand that healthcare sector works, जब तक we will not understand that the food, sanitary practices are very important, तब तक we will not understand कि ये जो चीज़ें हैं they are very very important. Unless and until these are not effectively working, we will not be able to understand that public health will ultimately be able to promote the global growth of the economy. So अगर इंडिया की global economic growth होनी है, so what I tell students is कि public health को एक ऐसा course लो. Why I am telling this कि public health अगर है, only then you will be able to have a sustainable development into the country itself. Now, public health as a course itself says that we are formulating the laws. There are certain policies, laws being told by the government, but at the end, these things has to be put into an agenda where the growing demand is increasing. Now, if I talk about India, India में policies हैं, regulations हैं, India में हर चीज़ available है. But then public health something where is lying. So global level पे भी at WHO, UNESCO, WHO organization, even United Nations organization, they said that the third rule in themselves is good health and well-being, which can only happen if there is a sustainable development. Now talking about good health and well-being, what do you understand by that? So global health and well-being is actually the maternity mortality is increasing. Now to suppress that, you have to understand there should be vaccinations available, there should be clean water available, there should be clean air pollution should be reduced. So after this only we will be able to understand कि हमारा public health sector बढ़ रहा है, and because of this there are more career opportunities available. Now because yesterday also there was 458 severe air pollution index, so which means there are not proper policies inculcated into the environment, not proper policies told into the embassies. So now we understand that the demand is increasing, but then again we have to understand with the demand itself, we have to meet the growing employment ratios of the country itself. Now talking about policy making in public health itself. When we talk about policy making, these are basically the rules, regulations and the laws that are being formulated. But these are not just substantial towards the public health. You have to formulate it in a way that it is meeting the community needs as well as it is promoting the health of the community. Public policy hai very good, but then we do not have people to formulate these laws into the subjected areas. So United Nations, WHOs, UNESCOs tell this that we need to have these people so that we can help for a sustainable development. Which is why I tell students that PCB ke baad sirf MBBS is not the only course, but also there are certain courses which are non-conventional in path, which is public health and public policy in itself. Now, when I talk about GDI, मैंने general overview दे दिया what GDI is. But then again, if people are choosing public health, they should know that Global Development Index is the major component and a measure in itself to understand how protecting we are towards our population and also how we are improving it. Because we cannot protect the population and then isolate ourselves. But we have to keep moving with this agenda. And since we start moving with this agenda, there is also a reason that जितना हम आगे जा रहे हैं फ्यूचर में सस्टेनेबल डेवलपमेंट उतना डिमांड में आए जा रहा है विद एयर पॉल्यूशन इंडेक्स इंक्रीजिंग विद एनवायरमेंटल थिंग्स कमिंग इनटू कंसिडरेशन ग्लोबल क्राइसिस आ रहा है सो देयर इज अ डिमांड बट द सप्लाई इज वेरी लो फॉर इट नाउ टॉकिंग अबाउट public health and policy making, how it can be initiated. So I've seen a lot of schools that do not have a core proper subject in itself. So you guys will not have an idea how you have to pursue public health, how you have to pursue public policy. For example, in my case, I was not able to understand that I can go for a master's in that, but I was not able to understand master's करने से पहले what I have to do at an undergraduate level. So कुछ चीज़ें should be included and we should touch some things in our curriculum at the school level itself so that the people understand that this is very important, and the curriculum, if it is introduced, students will understand that public health and policy making is a career and we can revolve around it. So for example, we do not have to introduce the subject apart from biology or social sciences into the school level, but rather we have to just touch on the subjects like environment health dekh liya in the subjects. We should also talk about epidemiology. We should also talk about how global health system are working. We should also talk about policy making as a chapter. So that initially they are getting a gist of what is happening around the world, what is sustainable development, how it is connected with GDI, how it is connected with the organizations, how is it connected with the global level organization, local communities, how government is making policies and how it has been formulated throughout. Now, अब हमने ये सब इंट्रोड्यूस कर दिया, बट एट द एंड द स्टूडेंट शुड ऑल्सो हैव द केस स्टडीज. नाउ टॉकिंग अबाउट द केस स्टडीज, I know that I have to research on the COVID happened, what were the policies being formulated, we have to wear the mask, there were certain vaccinations being provided to us, there was Pfizer, there was Covaxin, there was Covishield, but we were not certainly sure which vaccine to use at what time. तो हमें ये idea नहीं था. Why? Because somewhere or the other we were not advanced with the knowledge of what is good for the public, what is good for what is not good for the public. It was just that the laws has been implemented कि Covishield or Covaxin use होगी, so the people using it. Now, to change the mindset of the students, to change the mindset of the population, we have to make them understand there are certain policies, there are certain public health issues, which is why we are using Covishield, Covaxin. So now we understand how things are interconnected with one another, and there is a growing need for everything in the market, but there are only conventional courses which is available to us. MBBS हो गया, biotechnology हो गया, biology honors हो गया. But there is something which is very good in the market right now, which is public health. Now, if we have understood about the research topic, we have understood about the case studies students are doing, we have understood that we have already touched upon on some topics in the school itself. But third thing that comes into picture is how we are integrating that. So, for example, tobacco smoking. So, for example, tobacco usage, for example, how air pollution index is increasing. So, there has to be practical instances involved into the theoretical aspects also. So that the more they research, the more questions they will bring up, and the more the questions they would have, the more career opportunities will be open in front of them. Fourth thing I think should be an initiative from schools, from universities, from organizations is collaborations and workshop at the school level. The more students will indulge themselves in the workshops with the NGOs, they will understand what is the growing need in the market, what is the problem that the people are facing in the market, what is the population going through, what are the communities or the welfare society having trouble with. So all these things are interconnected, and unless and until students does not have a practical experience, they will not understand the growing demand of the careers. They will just go in a conventional way कि PCM के बाद एक particular course ले लिया, engineering, computer science या कोई भी XYZ course, IAS officer. So that is something that we are more inclined towards. We are not seeing कि अब the time is changing, the sustainable development. So there is another sustainable development goals that has been initiated by United Nations also. So we have to also look what is happening there. Now, when I talk about when you go for a public health policy making as a specialized course in undergraduation, once you have studied and touched about the several topics, you will be studying 4 to 5 core subjects in public health. First is your epidemiology. Now, when I talk about epidemiology, it is basically you have understood that 100 cases were there in a week which happened to be COVID positive. Now, in coming another 5 days, there were 200 more cases. So now what you are calculating in epidemiology is, you are comparing not the 200 and 100 ratio, but you are understanding कि 5 दिन में 200 केस आ रहे हैं और एक हफ्ते में 100 केस आ रहे हैं. So what you are doing, you are analyzing the data. Then you are making understand other people also how we can make laws to prevent these COVID or maybe communicable diseases, infectious diseases. So basically, first you are understanding the data on the basis of the diseases that are happening in the community. First, that is epidemiology that you will be studying in a public health, which is a core subject. Second would be the statistics. So once you have understood the data, once you have analyzed what the diseases are going through, what everyday diseases are happening, you will then make a proper chart out of it, which will be used by the government to formulate the laws. Third will be global health. Now, since the COVID happened, India में बहुत cases आए, China में बहुत cases आए, but then you have to also understand कि globally वो कैसे affect कर रहा है. So at the global level, you also make sure कि globally भी एक ऐसी laws आने चाहिए, policies आने चाहिए that will be subjected to all over the world, not for a particular country. So for example, Pfizer यहाँ नहीं use हो रही है, and it was bare minimum even if it was in use. बाकी countries में it was very in a prominent way. So you have to make laws at a global level. Third course or fourth course that you would be studying here would be in public health, would be policy analyst. So now when you are analyzing the data, you are analyzing the diseases, you are analyzing what is happening, how you have to make the laws, the regulations, but you also have to analyze the policies that has to be made in the welfare of the people or the population. So might be some people have lung cancer. So you cannot, because of them having lung cancer, you cannot have them कि आप quarantine हो जाओ, you cannot go out, you cannot do this. So keeping in mind every condition, the population's condition, also understanding how the people are doing in their everyday lives, what their healthcare system is, then you have to make the policies, not just subjected to one or the other person. So it cannot happen at an individual level. It will be then isolated. It has to be on a social economic big grounds, so that it can take over for down the year 10, 20 years from now. Now we have understood the subject, we have understood how things work, interconnecting with one another. Then another thing that comes up is, how do you think that early education for public health should be introduced? So then, which we'll be talking about what careers that comes into picture after you've studied the public health. Now early education, it is very important, because if the young minds doesn't understand what is it, and they come into their notice at an undergraduate level, they would be inclined towards MBBS, biology, biotechnology. They'll be preparing themselves according to these domains. So now they would not make internships, volunteering activities into the existence, which will then suffice how they'll combat these opportunity careers into this world. So public health ke baad, what careers you can see is policy analyst you can become. You can become an epidemiologist. You can become a data manager for healthcare sector. You can work with an NGO. You can work with big organizations like UNESCO, WHO. So what you are doing in all of these, you are understanding the community at a bigger level. You are understanding how population is working at a global level. You are making policies to help these people, and it is in a growing demand. I cannot stress on this enough, that public health and policy making is something that is a very good career. So you are basically interacting with people, understanding how they are dealing with their healthcare sector, and understanding how you can change these things for them, for their positivity. So yeah.
As you have explained us in detail, and it has given the in-depth analysis, we talk only about the health, but we don't take care of the public health. And the most important thing is to know the origination, because we talk about various programs, we talk about various policies, but from where the diseases, or we would say, if we talk about the medical sciences alone, we talk about the medication, we don't talk about from where these problems are generating. So public health, if I'm not wrong, as a whole we can say that we need to study the origination first, if we are able to understand the origination, then the policy making would be easier. So we can say that the public health and the public policies are interconnected.
So yeah, from this I actually got to understand that since if public health is there, if the public policies are not formulated according to the public health of the population, then it would be of no use. So people has to study a subject which is related to epidemiology, studying the diseases that is available, studying how you can formulate these policies according to the public health. So these are the core modules that you have to study. Then initially you can take an elective subject like social determinants of health, because public health is again affected by the income that you have, education that you have, the economic growth of the country. So all these factors, the social determinants, will again affect the public health. Now, if you're studying the social determinants of public health, you'll also be able to understand and formulate the laws again. So this loop keeps on moving according to what you are studying, according to what you are based in. So you cannot make laws on a generalized manner, but everywhere, even in a local community, it will be different from global level. It will be different, global level will be different from country wise, state wise. So there is a growing demand for globally, state level, local level, community level. So they need welfare at each level, and I believe the career in itself is rewarding, but then again you have to be very particular about what the population demands from you and what you are delivering it to them.
As you rightly said, from country to country, from state to state, from region to region, the public policies may differ because of the demography, the geography, the climatic condition. So taking all these perspectives into account, the disease emerges, and because the disease emerges, in accordance with that, the public policies are formulated, so one need to study in all.
Why not? So for example, if I take in rural areas, maternal mortality rate is increasing. So we have to understand what they need. They need policies regarding the vaccination system. They need policy regarding the sanitation. They need policy regarding the clean water supply. So there, the policy makers will work differently, where it will work differently at a global level. So that derives of an example how things are different at each level and how it has to be formulated. So we just does not have to be like in a mindset कि मेरे को UNESCO के साथ काम करना है, मेरे को WHO के साथ काम करना है. But we can also work at a local level, and that with time, understanding at a local level. So for example, if we are working with a startup, we understand more how we have to be working in each sector more prominently, and then at a global level we will be able to suffice with it because we have understood basic minor concepts at a startup, and then we'll be able to work globally in a better way.
From your conversation, it is clear that one has diverse areas in this particular field. Just the matter of difference is we always predict and perceive the things the way we want it.
Yeah.
We think, no, this is the limited area, or this is the area where I can work on and can make my career, and it is limited. This is the perception we generally have. But after this talk, I would definitely say the students who might have watched and would be watching us through YouTube, now they have this clear picture that they have diverse areas where one can move ahead and make the career. So, Ms. Sejal, thank you so much for giving us this wonderful session, and I believe that in the forthcoming session we would be discussing more about how one could do a course on this particular subject and can have a blissful career. So dear friends, thank you so much for watching us, and we believe that your feedbacks, your suggestions, your questions are very, very important for us. Do write to us at cecgurukul.live@gmail.com. We are going to discuss more only for you. Thank you so much.